Hi guys, my name is Jeffrey. I'm doing my 10 article assignment. My research question consists of what are the effects of creatine monohydrate supplementation on physical performance and how beneficial it is really when preventing sarcopenia. I'll define sarcopenia and what creatine is. If you don't know what it is, I'll explain it. But before I'll start off my inclusion and exclusion criteria. Uh, As you can see, it says that any study that was conducted that includes creatine monohydrate supplementation involving aging adults. I included aging adults because that's what mainly I'll be focusing when I'm talking about sarcopenia. I also defined the term the effect on physical performance because that's kind of a vague kind of category or saying. I define it as being improved statistical measures rather than the negative statistical measures, and beneficial being defined as improvements with possible questions or more studies needing to be conducted rather than looking at the downsides of it. Okay, so starting off with my first, or I'm doing my last one because I felt like that was the one I get most out of, and it'll be the creatine monohydrate and conjugated linoleic acid improve strength and body composition following resistance exercise in older adults. I'll start off with this. Creatine monohydrate. Actually, I'm gonna start off reading what sarcopenia is. So sarcopenia happens when you're getting older and you lose muscle mass and strength, which leads to functional impairment of daily activities that you do on a daily basis. And the scientific definition is right here. It refers to a reduction in fat-free mass that occurs with aging, and it's proven that through multiple trials and tests that creatine, along with the conjugated linoleic acid, helps reduce sarcopenia, or along with resistance exercise training. This is the abstract. The abstract talks about what they conducted and what they got, and it showed that it could enhance strength gains and improve body composition, such as fat-free mass, decrease of body fat in older adults. And throughout all of it, the measurements of functional activity and strength increased compared to the placebo groups where it didn't increase at all. Some creatine supplementation can enhance increase in fat-free mass with a several-month resistant exercise training program. And then they believe that the creatine may enhance resistance, excuse me, induce strength gains, including activation of myogenic determination factors, and enhancement of satellite cell activation recruitment, and so on and so on. This mainly talks about how as you get older, these functions start not working as well. And creatine can help increase, enhance the resistance, or it going back to normal when you're younger, but not really. Where is that? Okay, so looking at this table shows the pre and post for women and men with the placebo against the supplement group. Looking at chest press, how you got pre before the muscle, before they start doing the resistance exercise training. It's not bad, and then post is better for both women and men. But with the supplements, you can see that there's a big increase on posts for multiple of these categories of exercises. So it shows that creatine along with conjugated linoleic acid helps give that helps against the deterioration of these right here. And this is basically confirming that they have the beneficial effects of resistance exercise training on increased fat-free mass, strength, and function in older adults, in combination with creatine monohydrates and conjugated linoleic acid, lead to greater increases in fat-free mass and loss of fat masses. Okay, well, on to my second article, or second to last article, because I'm going backwards now. This talks about exercise and nutritional interventions for improving aging muscle health. Okay. To prove how my research question goes back to here, what are the effects of it? Creatine monohydrate and like other, how can I say this? Let's just read it off. Forget it. In addition to exercise, creatine monohydrate, milk-based proteins, and essential fatty acids all have biological effects which could enhance some of the physiological adaptations from exercise training in older adults. So, like I was saying about sarcopenia, is defined as the age-related loss in muscle mass and strength. Right here, and it affects a lot of us, like as we get older, because we start to deteriorate. Creatine, okay, yeah. Creatine has shown to have a positive effect on satellite cell differentiation, activity, and content in young males performing structured resistance exercise training. However, the effects of creatine on aging satellite cells are unknown. This gives us a clue and understanding of how this possibly might be able to work for for older adults, because not having be able to test it yet and having some studies performed on hand on younger males gives us an idea of it possibly helping, which is very beneficial in the study. And then, for example, older men supplementing creatine during resistance exercise training program experienced a significant reduction in urinary excretion of 3-methylhistidine, an indicator of muscle protein catabolism, by 40% compared to an increase of 29% for placebo. As we get older, we pee out the muscle protein catabolism, and having creatine supplement it with resistant exercise training, we pee less of it out. So that, coming back to how preventing sarcopenia is when you get old, you start deteriorating your body. But if we're not peeing this thing out, we are actually beneficially it being better for us as it slows it down. So basically, yeah. The third article, or third to last article I'm doing, is the potential benefits of creatine and conjugated linoleic acid as adjuncts to resistance training in older adults. To prove, to go back into my research question, how, like, what are the effects of it and the physical performance, and it is when to preventing sarcopenia. Right here are studies, and several others have found that creatine monohydrates enhance the resistance exercise mediated gains in fat-free mass and strength. That focuses on the physical performance side of that question. And then this second one right here in the abstract focuses on the sarcopenia side, which is it suggests that creatine supplementation in combination with strength training can enhance satellite cell activation and total myonuclei number per cell per muscle fiber in young men, and that is what deteriorates as we get older. So that shows how this slows it down. And where's my right here? So the studies that they conducted it showed that there was an increase in number of repetitions performed during high intensity and resistant type training versus like the placebo. That being said, I mean, creatine does that to your body because it gives it more of that boost to it, if I can recall correctly. Uh, right here as well. Given that resistance training is the most potent countermeasure for age-associated sarcopenia, and that creatine monohydrate supplementation can further potentiate the fat-free mass and strength gains during a resistance training program, it is likely that these effects can translate into more functional significance in older adults, which is what I'm looking for. Coming back to my research question, and the slowing of muscle relaxation time and aging may be partially reversed by creatine monohydrate supplementation. Working off of that, it comes down to it actually helping our body slow down sarcopenia. There's no conclusive answer to preventing sarcopenia, but slowing it down helps us figure out the answer as we work on it. And then it comes down to here, it is clear that the higher intensity resistance training with creatine monohydrate supplementation is a safe and effective intervention to increase strength in older adults. By increasing strength in older adults, that reduces sarcopenia, because when sarcopenia occurs, you are losing muscle mass, and by balancing it out, you are prolonging sarcopenia. And that will be done for this article. To my fourth article would be right here. This is nutritional recommendations for the management of sarcopenia. Why is this? Oops. Right here. I'm going to refer to the table because this talks about like the sarcopenia recommendations. The focuses on creatine may enhancing the effects of exercise in sarcopenic patients, but as I was reading this, they didn't work on the study in a long term. They only focus in short term. So I feel like this one isn't as strong of a article I can use as I look at it now compared to my other 3 articles that I've been doing. But as I'm doing this right now, the creatine supplementation increased lean tissue mass as well as increased leg strength, power, and endurance. In a study of men and women 65 to 86 years, creatine supplementation for 14 days increased maximal isometric grip strength and physical working capacity at a fatigue threshold. That being said, that's very small. That's like a small sample size in the trial period, as we don't know is this effects being conducted more beneficiary for sarcopenia, but it shows that there is some slight improvements to older men and women. And then overall, although short-term studies suggest some benefit of use of creatine in addition to exercise in sarcopenic patients, there is a need for long-term studies. Like I was saying, as I was reading it, they didn't really conduct it as with long-term study. So that being said, this article is kind of weaker when I come to think about it now, as I was looking. But on to my 5th article. What did I do that? Okay, put it back in. Okay, so this is the timing of creatine or protein supplementation and resistant training in the elderly. As I was reading some of these articles, they talked mainly about like a lot of the being timing, connecting back to how like it will really benefit preventing sarcopenia. So I feel like that's something I probably need to add into my research question as I go on, if I were really to conduct this study. But onto this article. This right here, it talks about how there's been a few studies that report that creatine supplementation during resistance training increased muscle mass, muscular strength, endurance, power in older individuals. But there has been some studies where there weren't no beneficial effect during resistance training. So this is why multiple studies need to be conducted, as you don't ever know if it's just the the patients that are being tested are just outliers to the study. So that being said, it's very it gives us an idea of how the study hasn't been biased. Right here it shows a positive effect from creatine supplementation is equivalent. This is go back to the same thing as it shows how it doesn't. Sometimes it has effects and benefits, and then sometimes it doesn't. So that being said, from when this article's been published, which I can't probably look at it. It's right here. It's published in 2007, so that gives us a basis of it being need to be studied more, because they were creatine supplementation increases measure of lean tissue mass, strength, muscular endurance, and muscular power over placebo. That's been shown in previous articles, along with this article, as I'll go on. Right here. Okay, during 8 weeks of resistance training in males and females, 67 to 80 years old, the group sizes were small, and therefore the study lacks statistical power. But even though, oh wait, no, this one actually shows the downsides of it, which I wanted to include in discussing the articles, as this one showed a small sample size and it showed that it didn't increase muscle mass. So, but when you have a small sample size in groups of 4, and it's 4 different groups, it's kind of hard to see your results, because sometimes those adults could be outliers to the experiment, and if you have that in multiple of your trial groups, you don't want that. And having possibly 1 or 2 outliers in a group out of 4 isn't very beneficial to conducting a study. Right here, they focus about timing of nutritional intervention. I'll discuss that in later articles, but I'm gonna go here. The effectiveness of creatine or protein supplementation during resistant training in elderly is equivocal, with some studies indicating a benefit from supplementation and some studies showing no benefit after training. And then this wants to focus on the timing of nutritional intervention, may be important for enhancing regular resistance training sessions in the elderly. That being said, they want to mainly really what was it? I lost my track of thought. Yeah, they want to focus on the timing of it, as taking it sometimes before, slightly before or longer before, probably compared to an hour to 15 minutes before, or 15 minutes to an hour after, could alter results. So them wanting to focus on the timing of it would be beneficial to the test or experiment. I'm sorry. And then down here is basically saying what I just said, but then the effects on physical performance is, as I look at this one, as I look at this article doesn't, it shows the effect of creatine monohydrate on physical performance, but when it comes to how beneficial it is preventing sarcopenia, it doesn't really go deep into it. So looking at this article seems kind of weak when answering the second part of my question. On to my 6th article, if I recall. Yeah. 6th article. And this is the effect of nutritional interventions and resistance exercise on aging, muscle mass, and strength. I'm going to go back to sarcopenia, being defined as the age-related loss of muscle mass and having a negative side effect on like strength, functional independence, and overall quality of life. Talking about overall quality of life is just like your daily interactions, daily activity that you do on a daily basis, and not being able to do that would talk about the overall quality of life. Coming down here, talking about creatine mainly focusing rather than other supplementations. I would focus down here out of these pages. This shows how furthermore older adults may experience residual beneficial effects once creatine supplementation ceases. For example, in healthy older males, 12 weeks of creatine supplementation resistance exercise produces significant gains in muscle mass and strength. So, having that 12 weeks of having creatine and just resistance exercise, it showed that there was results of being benefit to sarcopenia along with the physical performance, as they had significant gains, and having significant gains thus results in prolonging sarcopenia. Coming down here, creatine might also have anti-catabolic and antioxidant properties that could benefit aging muscles. Creatine decreases urinary excretion, which I mentioned in one of a previous article. And with that being said, just it benefit aging muscles. It prevents sarcopenia, as I can relate back to that question again. Now, this talks about a lot of the other like essential supplementation that you can go along with it that could benefit sarcopenia in another way. I could probably look at that, making my question more vague when it comes to this assignment, but right now I'm just focused on creatine monohydrate. And this basically sums it up, basically saying in addition to resistance exercise, nutritional interventions of essential amino acids, milk-based proteins, creatine monohydrate, omega-3 fatty acids, conjugated linoleic acid, and vitamin D have shown promise for mitigating age-related. So this basically answers the second part of preventing sarcopenia. On to my this is my sixth article. The seventh article. Oops. This talks about the strategic creatine supplementation and resistant training in healthy older adults. Coming down here, there should be that answers this question. Where is it at? Sorry. Right here. In conclusion, creatine supplementation increases lean tissue mass and muscle strength in aging adults. That being said, that focuses on the physical performance side of the question, being it increases lean tissue mass and muscle strength. And consuming creatine before and after resistance training sessions produces similar results. However, ingesting creatine immediately following resistance training augments muscles accretion compared with resistance training alone. Further research should investigate the actions of creatine on aging muscles before they can really determine the results. With that being said, that answers both parts of this question. This article talks more about the statistical measures of what happens when they take the creatine. I should have gone into that, but it felt like some of it was wouldn't prove my point. On to my eighth article, which is creatine supplementation and aging musculoskeletal health. The combination of creatine supplementation and resistance training may further lead to greater physiological benefits, such as improving bone mineral density and indices of bone biology. The combination of creatine supplementation and resistance training can be an effective intervention in improving aging musculoskeletal health. That being said, that talks about the preventing sarcopenia side, along with it being preventing sarcopenia. It focuses on the physical performance side of this of this article. It's defining sarcopenia in this article. They talked about how the loss of muscle mass and muscle function due to inherent variability among older adults. And then there's different like severity of sarcopenia, which is like low muscle mass and reduced muscle strength or physical performance, and then low muscle mass and reduced muscle strength and physical performance. And sarcopenia is like a main contributing factor for like multiple things. But frailty is the word I was looking for, is the one that's most common in aging adults. I'm gonna go down to the table in a little bit right here to discuss it, and then this is like the how like there is some downsides to it, so I'm not being like super positive and biased on this research. In contrast to positive studies described above, there are a number of studies that have found no evidence. So it just depends on the individuals, I feel like. And then showing this article down here shows like the what each thing means, which is the up arrow is a significant increase, and then the arrow that goes to both sides showing how there's no difference compared to the placebo group. Showing the study population along with how much creatine and like what they've done with it. It shows like how there is beneficiary measures when you do take creatine monohydrate along when you're doing your resistance training program. As you can see here, 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 and here. And to finish off this article, excuse me. Therefore, the combination of resistance training and creatine supplementation should be considered when developing effective lifestyle interventions for improving aging musculoskeletal health. With this in mind, future research may also want to. So, like, they just want to make sure, like other people, when they're coming down to this, looking at it, that there does need to be further studies, as this doesn't prove that it prevents sarcopenia and the effects of it on the physical performance is like beneficiary, as they have mixed results of it being with the placebo group of it having no effect and some effect. The second to last article is the sarcopenia current theories and the potential beneficial effects of creatine application strategies. I think I defined sarcopenia enough. This right here shows how many people have sarcopenia and how like there's an increase as we get older, and how much it affects our economy and like how much we're paying for it, along with just it might rise in the future as we're living longer. Down here it says increasingly there's a research showing a positive effect from creatine supplementation on age, on muscle creation in the aging population, which is shown in the table which I described. This is like the other table shown in the last article, how it shows that when they take creatine, there is, compared to the placebo group, with the resistance training, that there is an increase. There's like no decrease. So that being said, this prevents sarcopenia, and it shows that the effects of creatine monohydrate supplementation on the physical performance part aspect of the spectrum. And then just to summarize and basically conclude it, in addition to exercise, creatine supplementation has been shown to increase muscle mass and strength in older population. But this one also talks about the timing of it, which is like what I was mentioning before in previous articles, talking about how they want to focus on like maybe like 15 minutes compared to an hour, or like 15 minutes before or after. Last article. Okay. This is creatine supplementation does not alter neuromuscular recovery after eccentric exercises. As I was reading this article, this doesn't really talk about it affecting older people. So when it comes to this is one of those articles I might not use, as I needed to find a stronger article. But to talk about this article, this talks about this just talks about what creatine is. The research into the effects of creatine on muscle damage and subsequent recovery is limited. Creatine may also have a positive effect on muscle recovery from it. and increasing satellite cell numbers and myonuclei concentration, activating genes. That part right there is mainly focused on preventing sarcopenia. Sarcopenia is when that deteriorates your body, and then you start losing some of these small functions inside of your body. And the creatine, it just increases it back, rather than, so like it kind of balances this out. And that's it for my 10 article assignment. Yeah. All right. See you guys.